And for me also, it's a benefit because the surgery is done with the patient lying on their back. Traditional hip replacement surgery, your patient's lying on their side. With the patient lying on the back, the anaesthetist is happier. They can manage the airway much more safely with the patient lying on their back. For me, it means I use X-rays during the operation. So I have an image intensifier in theatre during the surgery. So I can actually visualize with the X-ray rather than doing a hip replacement, even a navigated hip replacement, even a robotic hip replacement. The surgeon will finish the operation and want to have a check X-ray maybe the next morning to say, yes, I put it in exactly where I wanted it to go. I get that reassurance during the operation.
And that's
so I see.
Approach, then?
Sorry?
That's something you can't do with a posterior approach, is that?
No, you can do it, but it's more challenging with a posterior approach because the patient's lying on their side and the X-ray has to be tilted up over the patient, so that the positioning and it's a little, it's a little bit more challenging to do. It's not impossible, but it means that most surgeons don't routinely use X-ray imaging during hip replacement surgery, traditional hip replacement surgery. They may well template their X-rays prior to surgery so they know what the size of implant they expect to use. They will predict where their implant is going to be, but they're left in a position where at the end of the operation they stitch up and then they are waiting for the next day for the X-ray to see what the outcome looks like, whereas I have that reassurance during the operation.